Hello family. I hope that this video finds everybody safe and well. Um, I wanted to do a video, did a video earlier today, and I may actually replace that video with this one because there was something that came to mind when I came home in regards to mammogram. So today I mentioned that I got a mammogram, and I mentioned that because I live in the state of Texas, in the past when I've had mammograms, by law, they are required to let me know that if I have dense breast tissue. And so because I do, I want a 3D mammogram because the imaging is stronger and they're able to possibly see things that a 2D mammogram might miss. And so early detection is so important. However, having the stronger imaging in regards to the 3D is actually better for me because of my makeup. And so today I went to get my mammogram, and before I went though, I was concerned. We're blessed that today we have health insurance, but there was a time when I didn't. And I still made sure to get my mammograms. And so I'm going to talk to you about that too. However, last week, I wasn't sure if my health insurance covered the 3D mammography. And so I contacted my health insurance. They were trying to tell me something about some CPT codes that my doctor would have to have, ordered or sent in to the health insurance in order to code it so that it is considered preventative. So I wanted to try to say that right. And so I told the lady that my doctor had not ordered my test. This is something that I do every year as a means of my own preventative care. And so because of that, I wanted to see if the health insurance covered it. And since she said something about my doctor, I decided to call the mammography center, since they were the ones who were going to bill for it, to see if they had coded it as preventative care, the 3D mammogram, since that's what I knew I wanted. And I bless the Lord, everything went smoothly, because when I contacted the girl, she said, yes, we by default do the 3D mammogram, and maybe that's because of my dense breast tissue. And so she said, we are going to do the 3D mammogram. It's considered preventative care. You're okay in terms of healthcare costs and not having to pay out of pocket for that, which made me very, very happy, because I believe in advocating on my behalf in regards to my health. And so as I learned about dense breast tissue, which I had not heard of before I was notified that that's what I have, once I stepped into the know, I wanted to make sure that I got the best care possible. But even before I had heard about that, knew about the 3D mammogram, I always made sure to get my mammograms every year. There was a time when my husband was self-employed and we could not afford health insurance out of pocket. And so I had to figure out a way in which to find a mammogram, in which to be able to get a mammogram. And so when I did the video earlier today, I realized, it hit me that, Felicia, not everybody has health insurance. So not everybody can has a health insurance program that they can call and advocate for themselves that way. However, you can still advocate for yourself by getting a mammogram if that's what you want. Where there is a will, there is a way. And so years ago, when we didn't have health insurance, I believe what I did was I contacted the Susan G. Komen Foundation. I explained my situation and let them know I don't have health insurance, but I want a mammogram. And I remember being directed, I believe it was to UT Southwestern, a hospital here, that had a program that was an outreach part of Susan G. Komen, where they sent the vans traveling around the communities in the DFW area in order to do mammograms. And so I called, found out where they were going to be located, gave them the information that they asked for about me, let them know that I was uninsured at the time, and that I wanted to make an appointment. They even gave me the option, because they traveled around in so many different places in the Metroplex. They gave me the option to go to a place where they were located that was going to be close to my area. I would simply drive there, park, climb up on the van, and get my mammogram done. And so I wanted to encourage you ladies. I know that COVID is out there, and that's true, but cancer is still a real thing. And so because of that, I wanted to encourage you to make sure that you're doing your preventative care. Preventative care is a way to stay wonderfully well. And even though you may not have health insurance, I just went on the Susan G. Komen website and clicked on mammograms, and a drop-down menu came up showing how to find places where you can get mammograms for low cost or free. So those options are still available today. I don't know if the traveling mammogram vans are still going around in the communities like they used to with COVID going on. I don't know how they do that, but I would suggest and strongly encourage you to go to their website. They have a helpline where you can contact them and possibly even talk to somebody and find out that information for your particular area. So just remember, do the preventative care. Cancer is a real thing, and we all want to be as well as we can possibly be, and early detection is key. Early detection is key. So this is just to encourage and hopefully inspire somebody out there. Even hearing my story about me getting mammograms as an uninsured person, but still getting them every year, just know that you can do the same thing. Take good care of yourself so that you can be wonderfully well. Okay, until next time, family. Bye-bye.